Because of potential manipulation of abdominal contents during percussion and palpation, resulting in an inaccurate interpretation of barge sounds as being hyperactive, auscultation is completed right after inspection.
Med-Surg chapters are about 50 pages long, and half of the time you can tell what is important. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters.
Welcome to part 2 of a chapter. We have chapter 55, Assessment of Gastrointestinal Function, outline. So for the next few chapters, we talk more about the disorders, diseases, but now in this chapter we have the assessment, and we have introduction, anatomy and physiology. Every time when we go into a system, they have the assessment, and it's a small review about anatomy and physiology. Then the real nursing assessment and diagnostic study that the nurse need to know about lab studies, imaging studies, sonography, and barium studies. And here it's subdivision and endoscopy, age-related changes. Every assessment chapter has age-related changes. And because of the smooth muscle tone decrease, heartburn, cancer rates. So this is my concept map for chapter 55 before we go into detail one by one. But if you want to hear a little bit about an introduction about gastrointestinal diseases are disorders that affect digestion, absorption, and excretion due to various issues like gas, bloating, constipation, gut inflammation, and even genetic disorders. Diagnostic those gastrointestinal issues at the right time, it's very essential for giving effective treatments and preventing any further complication. The commonly used diagnostic tests for gastrointestinal disorders are given in this chapter, in the following chapters. The gastrointestinal, they call it the second brain. And did you know that the system we are about to study is the only one in the body capable of functioning completely independently of the brain? It is often called the second brain because the enteric nervous system in your gut contains over 100 million neurons, more than you have in your entire spinal cord. It produces about 95% of the body serotonin, meaning that when patient says they have a gut feeling that something is wrong, they are physiologically correct. So in this chapter, we are not just learning about digestion, we are learning how to assess the chemical engine that powers our immunity, influences our mood, and sustain every cell in the human body. So the introduction, of the gastrointestinal, we always say GI system. One, its components of GI tract, it's the mouth, pharynx, esophagus, stomach, um, small intestines, and accessory organs like salivary glands, liver, bladder, pancreas. And B, we have primary function, intake, digestion, metabolism, elimination of food and fluid. C, additional function, hormonal, hematostatic action. So now we go and we start with anatomy and physiology. So we have overview of anatomy and physiology. This is the stomach. You can see a nice picture here. And in the next chapter, we're going to talk the first part and then another chapter for this part. So anatomy and physiology, the mouth, digestion begins in the mouth when mechanical and chemical breakdown of food. Deglutition involves the buccal and the pharyngeal esophageal phases, coordinated by cranial nerves 5, 7, 9, and 12. The site where digestion begins throughout mechanical breakdown, mastication, and chemical breakdown via salivary enzyme. Deglutition, swallowing, is a coordinated progress involving cranial nerves 5, trigeminal, 7, fascial, 9, gastropharyngeal, and 12, hypoglossal. The buccal phase is voluntary and moves the balls to the oropharynx, and the pharyngeal esophageal phase is involuntary and propels food into the esophagus. The esophagus is a muscular tube extending from C6 to T7 and transport food to the stomach via peristalsis. The lower esophageal sphincter, LES, prevents reflux of acid gastric contents. Dysfunction of the LES can lead to gastroesophageal reflux disease, meaning GERD. 3, stomach. We have secretes hydrochloric acid, enzymes, and hormones. Gastric mobility is regulated by smooth muscle, pacemaker cells, and atomic nervous system. A muscular organ that mixes and churns food to gastric juices to form chyme. Parietal cell secretes hydrochloric acid, and intrinsic factor chief cell produce pepsinogen, and mucous cells secrete protective mucus. Gastric mobility is regulated by autonomic nervous system and pacemaker cells. The small intestine, site of most nutrient digestion and absorption. Bile and pancreatic enzyme enter the duodenum. The duodenum is key for nutrient absorption. Villi line the small intestine to increase surface area. Composed of the duodenum, and ileum. The duodenum receive chyme along with bile and pancreatic enzymes for digestion. The duodenum is specialized for nutrient absorption, while the ileum absorbs vitamin B12 and bile salts. Villi and microvilli increases surface area for absorption. The next slide, we have the large intestine, which receive semi-liquid chyme throughout the ileocecal valve, absorbs vitamins like A, D, E, K, sodium and water, includes the cecum, colon, rectum, and anal canal, functions in water and electrolytes absorption, vitamin production like A, D, E, K by gut flora, and stool formation, peristaltic movements, and move ways towards elimination. Stool changes from semi-formed to formed before passing into the rectum and anal canal. Liver, located in the right upper quadrant and partially in the left. Function includes detoxification of blood, metabolism of carbohydrates, fats and protein, vitamin and mineral storage, synthesis of bile acid and lecithin, and production of clotting factors such as fibrinogen and prothrombin. We have gallbladder, stores and concentrate biles produced by the liver, contracts in response to cholecytokinin to release bile into the duodenum, aiding fat digestion. Lastly, we have pancreas, has endocrine and exocrine function. Endocrine secretion secretes insulin and glucagon for glucose regulation. Exocrine produce bicarbonate and enzyme for digestion of carbohydrates, protein, and fats, as well as the nucleus for DNA and RNA breakdown. Assessment. A nurse will assess the four, every quadrant, the four, and for the hypo, it's 5 minutes maximum before a nurse will say it's absent sound. But usually, in my experience, after 2 minutes and little, I was able to hear the bowel sounds. So we have the clinical examination. Gastroenterologists do a physical examination before going into the actual diagnosis for finding out disorders like diarrhea, constipation, acidity. After inquiring about your medical history, patient medical history, the gastroenterologist does physical exam like observation of the belly area for signs of abnormalities like visible masses or surgical scars with bulges. B, auscultation of duration, pitch, and intensity of the bowel sounds. Palpation of the belly regions to feel the presence of any masses or tenderness. The rectal exam for feeling bulges, masses, inflammation, or changes in muscle tone. Exception to the rule, in almost every other body system, the assessment order is inspection, palpation, percussion, auscultation. In the GI system is the major exception, where you must inspect, then auscultate. So in my thumbnail, I said, do not touch yet. So it is scientifically accurate that in our textbook explicitly validates this assessment in the assessment section because of potential manipulation of abdominal contents during percussion and palpation, resulting in accurate interpretation of the bowel sounds as being hyperactive. Auscultation is completed after inspection. So it targets a common exam trap, nursing exam like the NCLEX. Love to test this specific concept because it goes against muscle memory. So in this, furthermore, assessment includes very thorough history, physical examination, and review of diagnostic tests. History should cover nutrition, elimination patterns, appetite changes, pain, and prior GI disorders or surgeries. Physical examination includes oral inspection, abdominal assessment, inspection, auscultation, percussion, palpation, and identification of abnormal findings such as bruitis, distension, or tenderness. And here I said like between 5 to 30 sounds per minute will be normal. So the bruitis use the bell of the stethoscope over the aorta, renal arteries. If you hear a swishing sound, bruit, do not palpate, report immediately, could be an aneurysm. So these are a lot of key terms that I explained a little bit in nursing terminology video. Palpation, it's a technique used to feel the liver ages. Never palpate a pulsating mass. And the inspection findings, the coolant signs, blue, purple around the umbilicus. So these are the key terms from terminology, most of them. Diagnostic studies. We have the blood test. We have a stool analysis, endoscopic procedures, barium, solo, CT, colonography or virtual colonoscopy, MRI scan, ultrasound, renal function test, manometry, pH monitoring, breath test, lab test. We have lab studies, imaging studies. So I said ultrasonography, endoscopy. Oh, I forgot to. So myellaryngitis. So for the next chapters videos, I'm gonna have some issue talking. So let's talk about the blood test. So the blood test can help in diagnostic bacterial parasitic infection, celiac disease, and lactose intolerance by analyzing the blood count, liver function test, antibodies, and pancreatic enzyme test. The lab tests that are used to determine liver efficiency are CBC, complete blood count, blood albumin, which is a protein, and also liver function test. We have alkaline phosphatase and bilirubin. The stool analysis gives the overall picture of a gut health, as it helps in knowing the indigestion, absorption, microbial balance, etc. With the data from the stool analysis, we'll know what can be diagnosed, like conditions such as indigestion, constipation, diarrhea, IBS, malabsorption, infection, celiac disease, bacterial infection, etc. For the endoscopic procedure, chronic acidity, heartburn, and sudden weight loss needs thorough inspection of the intestine. Endoscopy is a non-surgical diagnostic test which entails examination of the stomach and digestive tract with the help of an endoscope. Biopsy, tissue sample, are also taken during the endoscopic procedure. This procedure can make an accurate diagnostic tool for assessing colon cancer, Crohn's disease, and ulcer. For barium solo, in the barium solo test, chalky white liquid called barium metal is used in X-ray procedure. Here we have a like a barium when indigest can help in view the stomach and intestine. When given an enema, it helps in imaging the colon and terminal ileum. Barium X-rays are used to diagnose conditions like ulcerations, narrowing, fistulae, etc. The CT colonography or visual colonoscopy is mostly used in colon cancer screening and also other conditions related to colon. They can give you accurate images about the tumors or polyp growth within the colon or rectum. They are considered superior to the traditional colonoscopy, as virtual colonoscopy can help to visualize certain parts that are difficult to see under the traditional. The MRI scans a beam of magnetic fields is sent through the body to detect the abnormalities for the organ in question. This imaging test gives an accurate image of the organ and its structure. Also, we can get a clear picture about the presence of a cancer or any other infection. The ultrasound is a diagnostic tool that uses high frequency sound waves to produce real-time images or of an organs, tissue, and blood vessel. Abdominal ultrasounds are used to examine abdominal organs like liver, pancreas, gallbladder, etc. The renal function test Chronic kidney disease can affect gastrointestinal function, causing upper GI symptoms like erosive gastritis, ulcerative esophagitis, and duodenitis. If a person affected with kidney disorder is knowing gastrointestinal um, if a person affected with kidney disorders is having gastrointestinal symptoms, the patient is first diagnosed and treated for kidney disease rather than gastroenterological symptom. So the manometry, a manometer is a device used to measure muscle pressure and movement. Esophageal manometry uses the systemic contraction and relaxation of esophageal muscle to evaluate achalasia. In the same way, anorectal manometry is used to analyze rectal sphincters for diagnostic fecal incontinence. The pH monitoring esophageal pH monitoring device are used to measure the amount of stomach acid entering the food pipe in the 24-hour period. This is mostly used for diagnostic GERD. It is also used to determine the effectiveness of prescribed meds. During the procedure, a thin tube is passed through the nose and positioned above the esophagus. The reading of the acid level from the sensor reading attached to this device. The breath test is a breath test in patient. It's asked to drink the beverage containing fructose or lactose so that they can leave their breath in the breath analyzer bag at regular intervals. This test can help in diagnosing infection, bacterial overgrowth, indigestion, and lactose intolerance. So, oh, my pin light. Here it's a little bit, and this chapter has a lot of safety alert. You need to go and look for the safety alert. So pre-procedure for barium NPO 8 to 12 hours, post-procedure and stool will be white clutchy for 24 to 72 hours. Here it's also the NPO until the gag relax return. This is very important. For the colonoscopy screening, it starts at the age of 45. Prep, clear liquids, 24 hours prior, NPO 6 to 8. Post, monitor for percussion, severe pain, and bleeding. And the patient will have like Fentanyl in their system, so they need a driver to take them back. So gastrointestinal disease are disorders in the stomach and intestine that includes bloating, gas, indigestion, nausea, vomiting, food poisoning, lactose intolerance, diarrhea. So those are various tests and procedures used to diagnose gastrointestinal disease. So some of those gastrointestinal diagnosis tools are, we said, manometry, renal function test, colonoscopy, MRI scan, barium, solo blood test, stool analysis, and endoscopic procedure. So make sure that you know the lab studies, CBC, that assess for anemia or infection, liver function test, For hepatic health, it's LLT, ALT, bilirubin, prothrombin time for chlorine status, urine and stool test for infection, bleeding, or malabsorption indicator. Don't forget about imaging studies. X-ray for obstruction or perforation, and Doppler ultrasound for blood flow assessment. Sonography, it's a non-invasive tool for evaluating abdominal organs like gall, gall, gallstones or fluid collection. So here is referred to the table 55.6 for specific types and abdominal findings. Again, barium studies used to visualize GI tract structure and function. So go and see table 55.7 for various upper GI, barium and enema. Endoscopy again allows direct visualization of GI tract, can be diagnosed. Again, table 55.8, where types such as EGD, colonoscopy, and ERCP. Safety alert, endoscopy, procedural care. After an upper endoscopy, the nurse monitors for the return of swallow before providing oral intake to decrease the risk of aspiration. After lower endoscopy, anticoagulants and aspirin, acetyl salicylic acid or ASA are usually held temporarily due to risk of bleeding. Age-related changes. We have digestion and absorption of nutrients are usually normal in older adults, and changes in function are primarily secondary to changes associated with rate of new cell growth as in other body system. A smooth muscle tone decrease in the GI system, contraction responsible for propelling food along weaken, and the movement of food throughout the digestive system is slower. This usually presents as constipation and may be accompanied by hemorrhoids if the constipation is chronic and requires straining when having bowel movements. If there is weakening of the cardiac sphincter related to ages, esophageal reflux may develop and the patient may present with heartburn. Cancer rates, particularly stomach and colon, increases with age. Loss of bone mass and changes in calcium regulation may also be associated with tooth loss in older adults that which affects nutritional intake and indigestion. Let's have a pop quiz for this chapter. Here you have already the answer. So what is the correct order of abdominal assessment? Inspection, auscultation, right? Percussion, palpation after. You hear a breathe over the abdominal aorta. What is your next action? Stop assessment, do not palpate, notify provider. Which cranial nerves are involved in swallowing? 5, 7, 9, and 12. Let's go to Anatomy and Physiology. Abdominal assessment. Unlike the other system, the GI order is inspection, auscultation, percussion, palpation. So that's why I left it here. So there's two. When you auscultate before touching, because palpation can manipulate the bowel and create false bowel sounds. So that's the reason. Stomach cells function. Know the key cells. Parietal cells secrete hydrochloric acid and intrinsic factor, essential for vitamin B12 absorption. Chief cells secrete pepsinogen for protein in digestion. Liver function. The liver is the metabolic powerhouse. Its crucial functions include detoxification, like drug and alcohol, synthesis for chlorine factor, fibrinogen, thrombin, and metabolism of carbohydrates like fats and proteins. Key anatomy of absorption. Different secretion have different jobs. The duodenum is for digestion, mixing with bile or enzyme. The jejunum is the primary site of nutrient absorption, and the ileum absorbs vitamin B12 and bile salts. So this is a little bit keynotes from what I said earlier. Safe deglutition swallowing requires coordination of cranial nerve 5, trigeminal, 7, facial, 9, glossopharyngeal, and 12, hypoglossal. Dysfunction here increases aspiration risk. An assessment and diagnostic, I talk very, very long. So we have the coolant signs, blue-purple coloring around the umbilicus indicates intra-abdominal bleeding. Bruitis, it's a shooing sound over the aorta may indicate an aneurysm. If heard, do not palpate. Stoma assessment, remember the 3 S's: skin intact, stomach pink and moist, and stool, which is consistency varies by location. Nutritional lab markers, albumin indicates chronic nutritional status. Pre-albumin, so 12 to 42 milligrams per deciliter. It's a better, more sensitive indicator of acute or recent nutritional changes. Barium study, nursing care. The priority post-procedure intervention is the increasing fluids and laxative. Barium can harden into like a cement-like mass in the intestine, leading to impaction or obstruction. Endoscopy, it's safety, it's at the upper GI endoscopy. The most crucial safety check post-procedure is ensuring the return of the gag reflex before giving any fluids or food to prevent aspiration. Age-related changes. The most common functional changes are decreased peristalsis, leading to constipation, and decreased liver size enzyme activity, leading to slower drug metabolism and increased risk of toxicity. I hope you enjoyed this chapter, and I see you in the part 3. Thank you for watching, and bye for now.
We finally made it!
Thank you again for your time and trust. anesthesia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.